guys, Dr. Will here from Miami Spine and Performance in Hollywood, Florida. We are here with John. For those of you that watched the video last week, you saw the first half of our visit where we went in and we did some active release technique on the shoulder. We worked on the capsule, we worked on some of the rotator cuff muscles, pec and lat. So what we were able to do there is we were able to buy some real estate in the area so John's going to be able to move a little bit better. Now we're going to use something called dynamic neuromuscular stabilization to make sure that John's body hits the save button on all the good work that we did when he walks out the door, okay? So the first position that we're going to put John in is going to be what's called the 3-month prone position, okay? So John is going to go face down for me. And I'll have you slide down a little bit, actually. You'll probably be off the face there. Okay. John's elbows are going to be in line with his ears. And so this position is aligned with the position that a 3-month-old infant is going to be in when they first lift their head up. And that's actually the age when we actually learn how to use our shoulder blades and how to extend our CT junction. Okay. So what I'm going to have John do is he's going to elevate himself by pushing through his elbows into the table. Just like so. You're going to bring your head up as well. Look down a little bit. Okay. So the first thing that we can see here is we have some extension at the CT junction, right? This is an area we were trying to work on, so we're going to be able to hold that. I'm going to have John lift up a little higher. Good. And then what we can see here is we have John's shoulder blades pinned to his rib cage, right? So they're in a nice stable position here. I'm going to have John lift his hands up just like so. He's going to stay on his forearms. Good. And what I'm looking for here is we're trying to get John to relax his pec. So in this case, the right pec is relaxed, left pec is not relaxed. So what I'm going to do is I'm going to just reposition his shoulder back a little bit. And John, I want you to try to screw your shoulder in this way. There we go. Okay. So now we have a little bit of activity of that rotator cuff. The upper traps are off, right? That's really important. And we have a little bit of decrease in tension in the pec. Okay. Now from here, I'm going to have John push up into my hand a little bit. Okay, and I just want you to take some deep breaths through your abdomen. Good. And I'm just monitoring the position of the shoulder blade. So push a little bit more through there. Good. I'm going to give John resistance this way. Don't let me move you. Right. So this is another way to indirectly affect the shoulder. I'm going to push him into internal rotation, so he's going to have to rotate out into my hands. This is a good way to get some activity of the rotator cuff there. 2 more breaths. Time. Good. Go ahead and relax for a second. Okay. So that's the initial position, guys. We're using that to just create some awareness of the shoulder blade and some extension of the CT junction. Now, in order to make this exercise a little bit harder, what we're going to do is we're going to put John in that same position, but now I'm going to have him actually let go with one of his arms so that he has to stabilize the other shoulder independently of this one. Okay, so go ahead and come back up, John, the same way, driving through the elbows, right? Spread your shoulder blades apart. Good. So again, for this exercise, we don't want the squeezing of the shoulder blades. We want this nice long position so you can see his back is wide here. He's looking down just a little bit. We have some extension through the CT junction. We have him trying to rotate his shoulders back in the socket. Hands are both up. Good, I'm going to cue him this way. I'm going to try to push his elbows together. He's going to resist me. Good. That's just going to create a little bit of outward pressure so we get some activation of the serratus. And then what I'm going to do here, John, is I'm going to have you, without changing the position of your right arm, I want you to try to slowly lift your left arm up. Good. Hold. Turn your palm up. Good. Keep pushing through this elbow. All right, so John's getting a ton of activity here. We're actually also getting some glute activity. And bring the elbow back. Good. And then same thing with the other shoulder. So go ahead and lock this in. Palm up. External rotation. And lift that shoulder up. Good. So you can see he does it a little bit more naturally on the left side here. And obviously this is the healthier of the 2 shoulders. We're getting some flickering here in the rotator cuff, which is exactly what we want. So go ahead and come back, John. Perfect. Go ahead and relax the lower back. Get back into the same position. Okay. So that's another variation that we'll use. So if you're a clinician that does DNS, a lot of times they'll progress from the 3-month prone position into the 3-month prone position with a lift off. You can have the patient move their shoulder around. In John's case, I think it was plenty of stimulus just to have him lift the arm up and feel that unilateral support. Ideally, we don't want to incorporate too much of the lower extremity, but again, this was a pretty challenging variation for him. And all we're trying to do is, again, introduce stability in the shoulder and into the shoulder blade. So we want to teach him how to use the shoulder and the shoulder blade and use that structure to keep him stable, right? So if he's out throwing a football, if he's doing jiu-jitsu, if he's in the weight room, his shoulder and shoulder blade are working together as one unit to prevent any kind of injury or degeneration in the shoulder, okay? Go ahead and stand up, John. So, or you can actually just lie on your right side for me. Okay. So now we're going to get into the 4 or 5 month sideline position, okay? So I'm going to have you scoop to that end of the table. So this is going to be congruent with a 4 to 5 month old infant that is going from lying on its side to propping up onto its elbow. And this is when a developing child first learns how to use the posterior capsule of the shoulder and use the rear delt actually as a prime mover, okay? Unlike a traditional, rear delt fly exercise or a face pull, DNS uses what's called closed chain, which means we're actually moving our body along the table instead of moving our limbs independently, okay? So in this position, I'm going to have John bring his knees up to 90 degrees, or maybe just shy of 90. He's going to get all the way on his side as if you're laying on his shoulder. We'll go ahead and create some support for the head here. Okay. The first thing that I'm going to have John do is so you're going to stay on your hip and your shoulder and just lift your ribs up off the table. Okay. So now we're creating a little bit of tension through the shoulder and the hip. We don't want him just lying on his side. We want an active position here, almost like a low side plank. Okay. And from that position, we're going to go into uprighting. Okay. So what I'm going to have John do is he's going to transfer his weight from the back of the shoulder and the arm to the forearm. So John's going to do this by pressing down and driving himself up into like a side bridge position. Okay. Now from here, I'm going to have John lift up, and we're going to create a lot of length through here. So John, I want you to lift to the ceiling and reach your arms away from each other, spreading your shoulder blades. So more reach to the ceiling. Yeah. Now keep that position and bring this arm down. So now we can see John is nice and tall through the shoulder blades, right? We have the shoulder blade adhered to the rib cage here. We're already getting some posterior shoulder activity. Now John's going to come down, and I'm going to guide him, and he's going to bring his weight from the forearm to the tricep or the back of the arm, okay? So I'm going to guide him down, and he's going to just control himself down. As he's coming down, the shoulder's going to the back of the socket, and we're going to end up in that initial starting position. Right, and he's feeling some shoulder stuff here, and we're going to come all the way down and just hold there. Okay. So what we're doing there is we're eccentrically strengthening the rotator cuff muscles. Okay. So again, John, prop yourself up, back onto the shoulder, lift this up. Good. Shoulder blades apart. Okay. Let's go through here. So now I'm going to guide the shoulder to the back of the socket. John's going to come down. Keep letting that shoulder go to the back, John. Now we're going to pause him here. Good, just hold. We're getting some really good activity of the cuff, so we're feeling those muscles working, and we're going to let him come all the way down. Back to that starting position. Okay, so again, this is a really great way to get there's very few exercises out there, especially traditional sort of gym, physical therapy exercises, where you'll get that kind of almost cramping, spasming of the rotator cuff muscles. And that's because those muscles are working really hard to try to do their job to stabilize the shoulder. When you train the rotator cuff like this, there's nothing wrong with these exercises. They have a really important place in rehab. But the primary function of the rotator cuff is actually to stabilize the shoulder. It's not to rotate the shoulder, right? So we have to train that stability function of the rotator cuff muscles before we train the actual movement function of the muscles. So we're going to show you guys this one more time. John's going to come all the way up. He's going to reach away from the table. So we have a nice good position of the shoulder blade that we established before in the 3-month position. And I'm going to have John slowly drop the shoulder back, shift his weight off his forearm into the front of his arm. Good. And I'm going to have him hold here. Hold. 5, 4, 3, 2, 1, and come all the way down. And again, we're feeling tons of activity along the shoulder blade. So this is a great way to build in some stability of the shoulder blade muscles. Again, guys, if you're If you're a doc interested in DNS, I highly recommend that you take a seminar with some of the great instructors around the country. If you're a patient that's in South Florida and you're looking for DNS, I know that we're one of the few clinics that offers it. And it's a great way to rehabilitate just about any joint in the body. So if you have back pain, shoulder pain, hip pain, even foot pain, we use DNS to rehabilitate the body and reteach the body how to properly move and stabilize as one unit. So thank you guys so much for watching. Please remember to hit the like and subscribe, and we'll see you next time.